According to the CDC, December, January, and March are the most dangerous times of the year when it comes to drug and alcohol-related deaths. Now, during the holidays, Utah healthcare facilities see an increase in demand for addiction-related services. ABC4's Northern Utah correspondent Kate Gardner tells us how these services could potentially save a loved one's life.
Addiction includes everyone. It doesn't discriminate.
Surveys from American Addiction Centers show that 84% of Americans feel moderately to overwhelmingly stressed, and 25% feel more depressed during the holidays. And it's during the holidays, hospitals like Ogden Regional Medical Center see the highest demand for addiction-related services.
People sometimes can feel isolated. They feel like they're concerned about not being able to be around their family because of their substances they're using and those type of things.
Justin Hatch says winter weather can add to that isolation, and this can lead to a relapse.
We operate under the disease model, so it's much like someone who has diabetes. If somebody who had diabetes, you would never say, stop choosing to have that.
The hospital offers inpatient and outpatient services. Hatch says this is important because the Ogden area has one of the highest levels of overdose in the state.
People are more likely to get in treatment and stay in treatment if they're connected, and they're connected long term. And so the nice thing about having the services here in Ogden is we can keep people engaged for a long period of time.
The goal is to help people before an overdose, but if that does happen, the hospital offers detox services.
Detox can be life-threatening.
So going through it in a hospital is one of the safest places to do it.
It isn't easy, and they do feel sick while they're going through that. What's really wonderful about our staff is they show so much compassion to those patients.
Hospital officials say families can look for the early signs of a relapse to help their loved one avoid a potential overdose.
Any kind of irregular behavior.
Like?
Maybe they're sleeping longer. Maybe they're staying awake longer. Maybe they're not eating.
In Ogden, Kate Gardner, ABC4 News.
Hospital officials tell us they take extra measures to be ready for the holiday influx and patients needing addiction-related services. They say one of the best ways to help those in this situation is to simply show compassion.